Most people spend about a third of their entire life asleep. And for most of those years, they never once questioned how they were doing it. The position, the angle, the side. It seems like such a small, harmless thing. But what if I told you that the way your body is positioned during those quiet, unconscious hours is doing something to your heart that you would never see coming? And what if I told you that after the age of 50, this risk becomes measurably biologically different than it was in your 20s or 30s? This is not a scare tactic. This is physiology. And once you understand what is actually happening inside your cardiovascular system while you sleep, you will never think about your bedtime routine the same way again. I'm Dr. William Lee. I'm a physician scientist and the author of Eat to Beat Disease. I've spent decades studying how the human body heals, how it protects itself, and critically, how it fails when we unknowingly work against it. Today, I want to talk to you about something that cardiologists discuss among themselves, but rarely explain to patients in a way that actually makes sense. Sleep position and heart health. Specifically, what happens to your cardiovascular system when you sleep in certain ways, why the risk profile shifts significantly after the age of 50, and what you can do starting tonight to give your heart a better environment to recover and protect itself. If this is the kind of real science-based health information you want more of, I'd encourage you to subscribe to BioSecrets right now. This channel is committed to bringing you the kind of content that helps you understand your body at a deeper level, not just surface advice, but the actual biology behind it. Let's start with something most people get completely wrong. There is a common belief that sleep is passive, that while you're lying there, your body is essentially on pause, resting, quiet, doing nothing of consequence. And because of that belief, people assume that what position they sleep in doesn't really matter. You're not moving. You're not stressing the body. So what's the harm? Here's the truth. Sleep is one of the most biologically active periods in your entire day. Your brain is consolidating memory. Your immune system is releasing repair signals. Your cells are performing maintenance. Your lymphatic system is flushing out neurotoxic waste from your brain. And your heart is doing something very specific and very critical every single night. During sleep, your heart rate slows and your blood pressure naturally drops. This is called nocturnal dipping. It's a healthy, necessary process that gives your cardiovascular system a chance to decompress after the demands of the day. Studies have shown that people who experience healthy nocturnal dipping have significantly lower rates of heart disease, stroke, and cardiovascular mortality. But here's the key: this process is fragile. It depends on the right conditions. And your sleep position directly affects those conditions in ways that most people have never been told. So let's talk about the position that carries the most risk, especially after 50. And that is sleeping flat on your back, particularly when combined with certain anatomical realities that become more common as we age. Now, before I explain why, I want to be precise here because this is nuanced. Sleeping on your back is not universally dangerous for everyone. But for people over 50, and especially for those who carry any additional risk factors, excess weight, mild sleep apnea that hasn't been diagnosed, a history of high blood pressure, or reduced cardiac function, back sleeping creates a cascade of physiological events that can quietly stress the heart in ways that build up over months and years. Here is what happens. When you lie flat on your back, the tongue and soft tissues of the throat are more likely to relax and partially obstruct the airway. This is basic anatomy. Gravity pulls everything downward when you're upright, but when you're horizontal and facing the ceiling, those tissues shift backward toward the throat. This contributes to snoring and, more importantly, to a condition called obstructive sleep apnea, even in mild subclinical forms that people don't know they have. Sleep apnea is not just about snoring. Every time the airway partially or fully collapses during sleep, your blood oxygen level drops. Your brain senses this emergency and triggers a stress response. Your body releases adrenaline, your heart rate spikes, your blood pressure surges, and then your airway opens again, the oxygen comes back, and your body settles until the next episode. This can happen dozens or even hundreds of times per night in moderate to severe cases. Now think about what this means for your heart. Instead of spending the night in that calm, restorative, blood pressure lowering state that protects your cardiovascular system, your heart is being jolted repeatedly by surges of adrenaline and pressure. Night after night, month after month, This is not hypothetical. Research has established strong, consistent links between untreated sleep apnea and increased risk of hypertension, atrial fibrillation, coronary artery disease, and sudden cardiac events during sleep. And why does this change after 50? Because after the age of 50, several things happen simultaneously that increase vulnerability. Muscle tone decreases throughout the body, including in the muscles that support the throat and upper airway. This makes airway collapse more likely. Blood vessel walls become stiffer and less flexible, a process called arterial stiffness, which means your cardiovascular system is less able to absorb and adapt to those sudden pressure surges. The heart's own ability to manage stress, regulate rhythm, and recover from irregular demands becomes less robust, and the prevalence of silent, undiagnosed hypertension increases dramatically in this age group. So you have a perfect convergence: more airway vulnerability, stiffer blood vessels, a heart with less reserve, and a sleep position that maximizes the risk of airway obstruction. This is why cardiologists are increasingly paying attention to sleep as a cardiovascular intervention, not just a comfort issue. But there is something else about back sleeping that affects the heart in a different and equally important way, and this one is less commonly known. When you sleep on your back, the weight of your abdominal organs and any excess abdominal fat presses upward against your diaphragm. This is called increased intra-abdominal pressure. It reduces the space available for your lungs to fully expand with each breath. It also increases pressure on the large veins, the inferior vena cava, that return blood from the lower body back to the heart. If that venous return is compressed or restricted, the heart has to work harder to pull blood through and maintain circulation. And in a person over 50 whose heart muscle may already be dealing with the early effects of age-related stiffness, that extra workload matters. It accumulates. It contributes to the overall cardiovascular burden that builds quietly in the background, never dramatic enough to feel in the moment, but significant enough to shift long-term risk. So which sleep position is actually better for your heart? The answer, supported by a growing body of cardiovascular and sleep research, consistently points towards sleeping on your left side. And the reasons why are genuinely fascinating when you understand the anatomy involved. Your heart sits slightly to the left inside your chest. When you sleep on your left side, the heart is in a position that allows it to pump with less resistance. The aorta, the largest artery in your body, which carries oxygenated blood out of the heart, exits the heart and curves toward the left before descending through your body. Left side sleeping aligns more naturally with this architecture. Perhaps more importantly, left side sleeping has been shown in research to improve lymphatic drainage. Your thoracic duct, which is the largest lymphatic vessel in the body, runs along the left side of the spine and empties into the left subclavian vein near the heart. When you sleep on your left, gravity assists lymphatic flow, helping your body clear metabolic waste, excess fluid, and immune debris more efficiently overnight. Left side sleeping also reduces the likelihood of gastroesophageal reflux during sleep. This matters for heart health because acid reflux can trigger vagus nerve responses that affect heart rhythm and can cause symptoms that are often mistaken for cardiac events. Reducing reflux during sleep reduces one more source of nighttime cardiovascular disruption. Now, the body also benefits from right side sleeping in certain contexts, and I want to be honest about the full picture. For people with advanced heart failure, there are some data suggesting left side sleeping may feel uncomfortable because of increased awareness of the heartbeat or mild changes in hemodynamics. In those specific cases, medical guidance is essential. But for the vast majority of people over 50 without severe heart failure, shifting away from back sleeping, especially if you snore, wake up tired, have hypertension, or have been told you stop breathing in your sleep, is one of the most important adjustments you can make. Let's talk about what the science actually shows us and what this means practically. Multiple epidemiological studies have confirmed that people with untreated obstructive sleep apnea have significantly elevated risk for major cardiovascular events. A landmark study published in the New England Journal of Medicine examined thousands of patients with cardiovascular disease and sleep apnea and found that the relationship between these two conditions was deeply intertwined. Disrupted breathing during sleep was not just a symptom of poor health, it was actively contributing to cardiovascular deterioration. Research from Harvard Medical School and other major academic centers has consistently shown that nocturnal blood pressure surges associated with sleep disordered breathing are among the strongest predictors of cardiovascular events. Not just daytime blood pressure, but what happens to your blood pressure while you sleep. And sleep position is one of the most modifiable factors affecting that nighttime blood pressure trajectory. A study in the Journal of the American College of Cardiology found that the relationship between sleep quality and cardiovascular outcomes was as strong or stronger than many conventional risk factors. Poor sleep architecture disrupted, fragmented sleep caused by repeated arousals was associated with measurably higher rates of atherosclerosis progression and cardiovascular mortality. These are not fringe findings. This is mainstream cardiovascular science. And it is increasingly clear that sleep, including how you position your body during sleep, belongs in the same conversation as diet, exercise, and blood pressure management when it comes to protecting your heart. So what can you actually do? Let's move into the practical side of this, because information without action doesn't help you. If you are a back sleeper and you want to shift to your left side, the first thing to understand is that habits built over years don't change overnight. That's okay. There are strategies that work. One of the most effective approaches used in sleep medicine is positional therapy. This simply means training your body to stay in a particular position during sleep. The easiest method is the tennis ball technique, sewing a tennis ball or similar object into the back of a sleep shirt. When you roll onto your back unconsciously during sleep, the discomfort of the ball causes you to shift back to your side without waking up fully. It sounds simple, and it is. But research on positional therapy for sleep apnea has shown it to be genuinely effective for position-dependent cases. Another approach is using a body pillow. A long pillow placed along your back when you lie on your left side provides support and makes it much harder to roll backward. It also gives your top arm and knee something to rest against, which makes left side sleeping more comfortable and sustainable. Elevation matters too. Sleeping with your head and upper body elevated by about 10 to 30 degrees using a wedge pillow or by slightly raising the head of your bed reduces the degree to which gravity collapses the upper airway. It also reduces intra-abdominal pressure on the diaphragm and can meaningfully reduce both apnea severity and nighttime acid reflux. This is a simple, inexpensive adjustment that a significant number of people over 50 would genuinely benefit from. If you snore, wake up with headaches, feel unrested despite sleeping a full night, or have a partner who has witnessed you stopping breathing in your sleep, please take those signs seriously. These are indicators that sleep-disordered breathing may be affecting your cardiovascular health right now, tonight, without you realizing it. Talk to your doctor about a sleep study. Modern home sleep testing has made this far more accessible than it used to be. And if sleep apnea is identified and treated, whether through continuous positive airway pressure therapy, oral appliances, or positional changes, the cardiovascular benefits are documented and meaningful. Beyond position, there are nutritional and lifestyle approaches that directly support your cardiovascular health during the hours you're awake, which then protect your heart during the hours you sleep. Foods rich in nitrates like beets, leafy greens such as arugula and spinach, and even certain herbs support nitric oxide production in your blood vessels. Nitric oxide is a gas produced by the inner lining of your arteries, and it acts as a natural vasodilator. It relaxes and opens blood vessels, reducing the resistance your heart has to pump against. When your blood vessels are more flexible and relaxed, the cardiovascular burden of nighttime pressure surges becomes less damaging. Omega-3 fatty acids found in fatty fish like salmon, sardines, and mackerel, as well as in walnuts and flaxseed, have well-established anti-inflammatory and antiarrhythmic properties. Inflammation in blood vessel walls is a key driver of atherosclerosis, the buildup of plaque that narrows arteries and sets the stage for heart attacks. Omega-3s help quiet this inflammation. They also appear to support more stable heart rhythm, which is particularly relevant when considering the arrhythmic stress that repeated sleep apnea episodes place on the heart over time. Magnesium is another nutrient that plays a quiet but important role in cardiovascular health and sleep quality simultaneously. Magnesium helps regulate muscle and nerve function, including the smooth muscle cells and blood vessel walls. It supports blood pressure regulation and has been shown to improve sleep quality and reduce the frequency of nighttime waking. Foods rich in magnesium include dark leafy greens, pumpkin seeds, black beans, and dark chocolate with high cocoa content. If you're over 50 and not intentionally eating magnesium-rich foods, this is worth your attention. Reducing alcohol consumption, especially in the hours before sleep, is also directly relevant to this topic. Alcohol is commonly believed to help people sleep, and it does initially by causing sedation. But alcohol fragments sleep architecture in the second half of the night, and more importantly, for this discussion, it dramatically worsens upper airway muscle tone. This means alcohol before bed significantly increases the likelihood and severity of airway obstruction during sleep. For someone over 50 who is already at elevated risk for cardiovascular stress during sleep, this is an important piece of the picture. I want to spend a moment on something that I believe is one of the most empowering ideas in modern medicine, the concept that small, consistent changes in daily behavior create measurable biological shifts. Your body is not locked into a fixed trajectory. The cardiovascular system has remarkable adaptive capacity. Blood vessels can regain flexibility. Inflammatory signals can be quieted. Nocturnal blood pressure patterns can improve. Heart rate variability, a measure of cardiovascular resilience, can increase with better sleep quality. You are not a passive bystander to your own biology. The decisions you make tonight, what time you go to bed, whether you drink alcohol before sleep, which side you lie on, whether you address that snoring you've been ignoring, these are decisions that compound over time. The heart you have in 10 years is being shaped right now by the choices you are making in what feels like the quietest, most invisible moments of your life. That is the most important message I can give you today. If you're over 50, please take sleep seriously as a cardiovascular issue, not just a comfort issue. If you snore regularly, get evaluated. If you sleep on your back and have any cardiovascular risk factors, try shifting to your left side. Use a body pillow. Elevate your head. Eat the foods that support your blood vessels. And please talk to your doctor about your sleep if you have any concern at all. You do not have to figure this out alone, and you do not have to wait until a dramatic event forces the conversation. I would love to know, what position do you normally sleep in? And after watching this, are you going to make a change? Leave your answer in the comments below. I read them, and I genuinely find it valuable to hear from the people watching this channel. If someone you care about is over 50, a parent, a partner, a close friend, please share this video with them. This is the kind of information that can matter enormously for someone who has no idea this risk exists. Sharing takes 10 seconds and could genuinely make a difference. And if you are not yet subscribed to BioSecrets, I encourage you to do that now. We are committed to bringing you real science explained in a way that is actually useful to your daily life. Every video on this channel is built on that same promise. No hype, no fear-mongering, just the biology that helps you live better. Take care of your heart. It works without rest every single day of your life. The least you can do is give it a better night.